If you're looking to lose weight and maintain it for long, then watch this video till the end. We have with us Dr. Neha Shah, India's leading weight loss surgeon, Lavanya, a trained nutritionist and dietitian, and Ranjita, a fitness trainer with us. All of them is part of the team at Swasthya Gastro and Weight Loss Center in Adyar, Chennai. Thank you everyone for joining us.
Thank you.
So Doc, my first question to you is, why it is so difficult to lose weight and maintain it for long?
Yeah, see, the main basis of doing today's program was we are seeing a lot of patients. Like last 20 years, I've been seeing patients. They get into one or the other program, they lose weight, but then they again put on weight. You know, they come back after 1 year. Whatever patients till now I have seen here, they always get into some or the other program, and then they are not able to maintain the weight. It is as simple as people go on a keto diet. They go on a keto diet, but then when they are on a keto diet, they lose weight. After that, again they'll put on the weight. Okay, so what makes this? We have launched a new program today, and that's why we are doing this video. What makes us different from the other weight loss programs? Like how this program will be able to help you to maintain weight on a very long term basis.
Right. So why? What can you elaborate on that and walk us through what are the various elements of this program and how is it different from any other program currently available?
Yeah. So see, till now what happens? We all know that different people have different genetics, right? Like what suits me may not suit you. What suits you may not suit me. I may be okay with rice. She may not be okay with rice. She may be not okay with wheat.
Okay.
So in this particular program, we have included the complete DNA wellness test of the patient. So we do the genetic testing where we study the complete genetic status of the person to figure it out, like what food suits them, what food does not suit them, whether they have any increased chances of cardiovascular events, whether they have any increased chances of diabetes, hypertension, cholesterol, whether what exercises suit them, what exercises will not suit them. It gives such a detailed analysis. Like yesterday I was going through one report of one of my previous patient. It will tell you that no, you have high chances of meniscal injuries and things like that, so you should not get into those kind of exercises. So running and jogging is not for you. So to that extent we will be doing the genetic testing, and after doing the genetic studies, then only we'll be doing the customized weight loss program for you. So it is a very scientific program that will help the people to realize what is their genetic makeup of the body, and accordingly they'll be able to change themselves permanently.
And it's very interesting. For the first time, I'm listening to anything where the genes are directly being attributed to what is your behavior and what you eat. Very interesting. Can you tell me what other assessments, if at all, we are doing as part of this program?
So see, till now we have been doing all the other assessments, like you do all the blood tests, you find out the macronutrient deficiencies, you treat all those deficiencies. But I've been always thinking that last 20 years I am doing this, and every time people get into whatever program, it may be bariatric surgery for that matter, but even after 5 years, 10 years down the line, we see some of the patients again come back with the weight regain. So what works for the patients? I was always interested in studying the genetics, body types and things like that. Even I did for myself as well, like what suits me and whether I have any tendencies of getting diabetes and hypertension. So accordingly I can change my lifestyle, I can change my food pattern. So I was always interested in this, and that's the reason we decided that yes, we are going to go ahead with this. Along with this, we do all the blood tests of the body, we do the scan. Then we see many patients nowadays you will see with fatty liver.
Right.
So fatty liver, always the teaching is like, yeah, okay, you lose weight and your fatty liver is gone. But in fatty liver, you need to do the fibro scan to find out like how much is the fibrosis in the fatty liver. If you have grade 1 fibrosis, then yes, it's very well reversible. If you have even grade 2, yes, still it is reversible. But if you have grade 3, grade 4 fibrosis, then there are high chances that it can end into cirrhosis of liver. So you have to be very careful. Then it is high time that yes, you have to do something about your fibrosis. So we have included the complete scanning of the body, and then we have launched a customized weight loss program according to the complete evaluation.
Very nice. So if I can summarize this thing, it's both preventive
Yes.
as well as corrective measure that we are recommending for weight loss and
Yes.
maintaining it for long.
Yes. So we will be doing the set of blood tests, and then we decide, like we give options to the patients whether you want to get it into the our diet-based weight loss program what we have launched, or you need some other things like bariatric surgery or whatever, you know. And depending on the complete analysis, because there are not everybody needs bariatric surgery.
Right.
Like there are a lot of patients who would like to lose weight, and there are a lot of patients who are post bariatric surgery but have put on weight, and they again want to come back to normal. They are not able to understand what's happening to their body. So unless you do all this genetic testing and try to tell them that, see, till now I have seen a lot of celebrities undergo all this genetic testing and everything. You know, they do the complete DNA analysis, and accordingly they change their lifestyle and the food pattern. Like I know in details about certain cricketers,
Right.
who Virat Kohli and all those people, they do that. So then I was thinking, why not the other people? You know, it is not that only celebrities need to maintain their health and only celebrities need to maintain their weight. It's not like that. Even the normal people. In this money, many times I feel money is not a criteria. You know, it's not that people are not willing to spend. The thing is, people don't know that things like this are available, and that's the reason I think we are the first one in Chennai to launch this. And we have a tie-up with lab in the north, and it is a, you know, USFDA approved site, and all the certifications are there, and it is really a proper this thing who does in a proper way the genetic analysis, and it is the only lab in the country who is doing. So that's the reason we thought we'll come out with this particular program. And you know, the unique thing about this program is it is not an online program. It cannot be done online because you know, motivation is something that is very important for this particular program. So you need to come every weekly once. So you weekly once you come here. I see the reports and everything. I do the nutritional correction. Then we put them on some medicine. Suppose if I feel that no, you need some weight loss supplements or you need some meal replacements, then I put you on that accordingly. I just give you for 1 week, okay, because I want to see how your body reacts to that. And we assess you every week, and every week they go to the dietitian, they go to the fitness trainer, and every week they guide them with the customized diet charts, and they guide them with the customized exercises. So it's a very interesting program, and 6 months they need to be with us.
So it's a commitment both from the team side as well as an equal level of commitment is
Yeah.
required from the user side. That brings me, Lavanya, to you. Ma'am mentioned about personalized diet. So what do you mean by personalized diet, and how would you plan it for the patient who's doing this program?
Yeah, I will be studying the existing diet pattern of the patient, and I will be reading their reports, DNA analysis report, whether what food suits them, what does not suits them, and whether the person is allergic to any food and everything. Depends on that, I will be giving them the customized diet chart according to their DNA analysis. And every week food will be given, and every week diet chart also will be given in a different way according to their reports. Food is from our exclusive leptin food store, health store.
No, that's very interesting, you know, because we were all going through all the brainstorming sessions, and I was asking Lavanya, how can we do something different? And you know, we came out with this option because every time we give to patients, and you know, they follow, they don't follow, they come back after 2 months and like, no madam, I could follow for a week, and after that I could not follow. And that's why I told this time this was nothing to do with, they are coming here every week. We need to see them, because that motivation only will keep them doing things, okay?
Right.
If motivation is not there, it's not going to work out for them. So it is a very beautifully planned scientific program, and we all have brought our heads in that, and this is from our last 20 years of experience, what works for them, what does not work for them, and then depending on all the complete analysis. And we have our leptin, we have launched our app leptin, so it's an exclusive app on weight loss. So from that we have a complete health store. So we are going to give food for 6 months. So we are not telling them, even if you are a working professional, We are not going to tell that no, you go search for broccoli and bring, or go and search for zucchini, you should eat only cucumber. It's not like that. We are going to give them proper food. So it's not that they'll be starving, they'll be eating healthy. So we will give them food for a week, and not everybody wants to eat the same kind of food. So we show them the store and let them decide, like, what they want to pick up, what is their food preferences, and once we have the genetic report in hand, we'll know what suits them.
Right.
If they are allergic to gluten, we will suggest don't take gluten. If they are allergic to rice, we will tell them don't take rice. We'll get all the allergy panel as well. So it will help them a lot.
Got it. So assessment is covered, intervention is covered, which
Yes.
is driven by you. Diet consultation along with food is covered. Now the other part is of course the fitness. And Ranjita, can you talk about fitness? That how do you plan to personalize and customize the fitness program for the users?
Yes. First, I will be studying the existing exercise pattern of the patient, each patient. Then, accordingly, I will guide recommended exercise as per genetic profile. And also, we are customized some types of activity. First, endurance based exercise, and aerobic exercise, and anaerobic exercise, and power based exercise, and last one is strength and resistance trainings. So every week I will be guide depends genetic analysis profile.
See, Ranjita is there with us for last 3 years, and she has learned everything. Like she's a certified fitness trainer, but at the same time she has been training the weight loss patients for last 3 years. So she knows what exercises, even the post bariatric patients, we teach them like what all exercises will help them. And one thing is there, like we do a lot of customization. Like suppose somebody has got, like yesterday she was teaching one patient who enrolled in the program. She was teaching exercises exclusively for the strengthening the knees.
Right.
Patient is having so much of knee joint pains, right? Patient was referred by an orthopedic surgeon from outside. So we teach them a lot of customized exercises, and she knows what to give. And so we have designed the complete program for 6 months, and after 6 months they'll be able to do the same thing in the house. So 6 months is a good enough time for you to get habituated with the whole thing. It is all about habit formation, right? Once you get the habit of doing things, like for me, I'm used to exercising, so if I don't exercise, I really feel that something is missing in life. I can't do without that. So it is very important that you inculcate good healthy eating patterns, good lifestyle, and that only. And this every week she will keep on torturing. So yeah, in one way patients do feel torturing that no, this week you have to do this exercises, next week you have to do this exercises. So it will keep on motivating them.
And I think 1 week is the right duration also, where they get a change also
Yeah.
when they're coming next week, as well as being able to follow the regimen for a week
Yeah.
before it gets changed.
So
So
nowadays,
I think-
it is only 1 week tolerance.
Yeah. Attention time span is
Yeah, especially the Gen Z generation. If you see, it is like 1 week is the max they will follow, and then they won't change.
correct.
They won't change. That was the whole reason we thought, okay, we'll design that exclusively like that. And one more thing that we have added in this particular weight loss program is, see, we have the cryolipolysis machine, like where we do non-surgical liposuction. Non-surgical liposuction means it just freezes the fat, and the fat goes off, it lyses and it goes off through lymphatics. Okay, so what we have added in this program, like suppose somebody is getting enrolled for the program and person feels that yes, they want to lose 15-20 kgs, at the same time they want to lose more of a belly fat. Belly only is the trouble for them. In that case, we do some cryo sessions of the belly. Every month one session comes as a part of the program, and along with that they have the massage and the steam bath as well. So once they do the massage therapy, a lot of lymphatic drainage happens, and even the obese people have a lot of extra lymph in their body. So once you do that drainage, they feel much better. So all those things are a part of the program. And we do customization of the program. Like suppose somebody has knee joint pain, then we put them on particular Ayurvedic massage for the knee joints, which help them in 6 months to lose weight, as well as the knee joints become much better. I'm not telling that yes, Ayurvedic massage cures the knee joint pain. So please don't think that way. But yes, once you lose your 15-20 kgs weight, and along with that, once the massage happens, definitely it will help you. Your knee joints will be much better. That is what we have seen in our clinical practice. We have been doing this for last 5 years now.
So, Doc, very, very comprehensive. Now, coming to outcome or results. So, what kind of results can we expect out of this program if someone is there for 6 months, and for how long they can sustain it?
Yeah, so it will be definitely 15 to 20% of their weight.
Wow.
So if it is 100 kg individual, yes, they will be able to come down to 85 or 80 kgs if they really follow the program properly. And once they come back to 80 kgs, and the whole thing is such scientific program that once you come back to 80 kgs, and once you know that okay, this suits me, this does not suit me, you have eaten one particular kind of food for last 6 months, definitely you are going to follow that. That thing is, I have still patients who are able to follow their weight for such a long time. I have patients who have come for the weight loss program 5 years back, 10 years back, non-surgical. I'm talking about the non-surgical. Still they are able to maintain the weight loss,
Right.
because once you change your lifestyle, once you change your behavioral pattern, definitely you will be able to maintain your weight loss.
Well, thank you so much. Very, very comprehensive program. 360-degree approach,
Yes.
covering everything. And please make use of this wonderful program designed by Dr. Neha and her team at Swasthya Gastro and Weight Loss Clinic, Adyar, Chennai.
Thank you so much for watching this video, and I'm going to personally send this video to all my patients first, and please go through the details of the whole program. And once again, thank you so much for watching this video.